and we're coming to you today as part of our PT Insider series. Today we'll be discussing shoulder pain. So Anna, could you please show the listeners or give them a few things that they can look out for when they're experiencing shoulder pain to maybe let them know it's a signal, hey, it's time to come in for some physical therapy?
Sure, thanks for having me. Most of the time, patients will report shoulder pain with daily activities. They'll say, I have pain when reaching into the cupboard for a dish. I have pain when I'm fastening my bra, when I'm reaching back for my wallet, putting a shirt on, pain when throwing the ball. Most of the time, that's when they'll report their pain. Once you have that pain, it is very important to identify these warning signs. The first one would be restricted range of movement with pain. So in other words, I am unable to lift this here and it's super painful and that's as far as I can go. Or I'm unable to go this way because it's restricted due to pain. And oh, this is all I can go right there. The second thing would be pain with movement. So yes, I can reach overhead. However, oh my gosh, it's super painful. I can reach out to the side is painful, and reaching to behind my back, that's painful as well. The third thing would be to sleep on the involved side. Patients will say, I absolutely cannot sleep on this side because my shoulder pain increases. And the third thing would be overhead dynamic movements. So athletes will say, I have pain every time I throw the ball, every time I set the ball, or every time I shoot. Painful. Once we've identified these warning signs, it's very important that we seek our physical therapist. The therapist will sit with you, do a thorough evaluation to identify the injury and the reason for the injury. Then they will develop a plan for you. It is very important to note that even though your shoulder can occur from one single injury, it is much more common to occur from a repeated stressor to that shoulder region. Once the physical therapist does the evaluation, they devise a plan and a treatment that is specific to cater to your goals and needs. It is very important that we identify these warning signs and take action right away. The quicker you take action, the quicker you can get to getting your shoulder back to normal. Thank you.
Yeah, that's great points, Anna. Thank you. Really appreciate it. And the good news is that physical therapy is very successful in treating shoulder pain. So thanks, Anna, again. Really appreciate your time. Thank you, listeners, for joining us for this episode of PT Insider Series. Look out for our next episode next month. And in the meantime, please follow us on Facebook and Instagram at Alliance PTP.